Ethical Perspectives on the News is produced by the Interreligious Council of Linn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV 9.
Good morning and welcome to Ethical Perspectives in the News. I'm the Reverend Tom Capo, minister of People's Church Unitarian Universalists, and I'll be your moderator for this morning's show. The Affordable Care Act, which was passed by Congress and affirmed by the United States Supreme Court, will begin to have an effect on Medicaid and the Children's Health Insurance Program. It's called CHIP. Very, very soon. Effective January 1st, 2014, Medicaid will be expanded to include individuals the ages 19 to 65, women, children, adults with dependent children, everybody, with incomes up to 133% of the federal poverty level based on modified adjusted gross income. This will significantly increase the number of people receiving Medicaid. Now, all the states have a choice of whether or not to opt into this program. If the state accepts this expansion, the federal government will cover 100% of the cost for 3 years. And then in 2017, the federal government will pay 95%, and then in 2020, the government will pay 90% of the cost. Republican governors across the country, including our own Terry Branstad, have chosen to reject this expansion of the Medicaid expansion program. And Branstad said about this expansion, "We're willing to help people who are willing to help themselves, but we're certainly not going to buy into this federal effort. We're going to fight it in every way we can." So the question is, should we expand Medicaid here in Iowa? What are the benefits? What are the costs to you and to me? To explore this issue, we have an esteemed panel to my left here. To my immediate left is Tim Charles, the president and CEO of Mercy Medical Center. Thank you for being here today.
Thank you for having me.
And then next to him is Gary Seacard. I did that right?
Yes, sir.
A member of the Libertarian Party of Iowa.
Correct.
And then far down on the left is Peter Damiano.
Very good.
I got it right? Okay, good. Director of the Public Policy Center and a professor in the College of Dentistry at the University of Iowa.
Morning, Tom.
Thank you all. Well, let's get started. Okay, first, I'm going to just toss this out to you guys. I'm kind of confused. Why not expand Medicaid? Are there problems? Are there something we should know about that don't know about that, you know, there's a reason for us not to expand? Is there a reason? Are there negative consequences for expanding? Anybody can jump in.
Well, I'd like to just start by kind of laying a groundwork of where the Medicaid expansion fits into the health insurance coverage within the Affordable Care Act, if I might, and then we can kind of go into the where it's good or bad. Right now, in terms of insurance coverage, there's some gaps, and so Medicaid is a program that is for the poor, but actually mostly covers and most of the costs for people in nursing homes and people with disabilities. And you have to be both categorically eligible and you have to be poor to be eligible for Medicaid. So with this expansion, what it will allow is everyone up to 133% of poverty, as you alluded to, will now be in Medicaid regardless of whether they are disabled or in a nursing home or are a mom or something like that. So that primarily affects single adults. And then for people above this Medicaid level, they will then be purchasing private insurance through the health insurance exchanges, which is a little bit different than what we're specifically talking about today, but just to sort of put that in some context.
So you're saying, I just want to be clear, anybody that's up to 133% of the poverty level is eligible.
Right, and that's the big change. It's getting rid of those categories, and particularly if you were a single adult, male or female, although more likely to affect adult men. But if you were a single adult and don't fit into those categories that make you eligible for Medicaid, you weren't eligible before. Now it's just if you're poor, up to 133%, you're now in Medicaid, and then everybody else goes in and purchasing private insurance. And in the whole, we're actually driving more people into private insurance than we are into Medicaid or into public insurance.
Okay, so now we know that. What are the consequences of doing this?
Well, the biggest question I have on the whole program is that most of the time the federal government says, a program is going to cost X number of dollars. They parade this to the people saying this is what it's going to cost. That's all it takes, and we'll have all these people covered. The problem there is that most of the time the incentives are not covered, and people end up using way more than they thought they would. So, you look at Medicare that went up, how many hundreds of percent since its inception, and it wasn't even supposed to be anywhere near that cost today, and it obviously is. And now we're going to open a system even more. So I think the problem that I have with it is that we don't really know what those costs are going to be, and they could be 100 times what we think they're going to be, because we just don't know. And that means that everyone pays those debts. Businesses do and individuals do. And now we're going to have to be paying this bigger piece of this bigger pie, and we don't even know what that's going to be. We didn't necessarily agree to that, but now we're going to have to pay that anyway.
So I would suggest that actually we are paying those costs, but we're doing it in a kind of an unusual way. And I need to actually begin by saying that I'm a member of the board of the Iowa Hospital Association, and we've taken the position to support the expansion of Medicaid. And I also should say that as the leader of a Catholic health ministry, my decision-making is informed by the ethical and religious directives of the Catholic Church, and the Catholic Church has clearly taken a position that the expansion of Medicaid is ethically an imperative because it actually serves and protects the dignity of human beings, and quality of life is central to that, and health care is an important component of that. So I bring both of those, both a decision which was based on very practical issues, as well as a more philosophical ethical orientation to the decision making. And the reason I say that we're already absorbing those costs is, as most of us know, there is a form of access that exists within healthcare today. It's called the emergency room. Mm-hmm. And day in and day out, we have individuals who actually come to the emergency room, one of the most expensive forms of delivery of care, delivery of the only primary care that they may have access to, because there is an absence of the ability to find either providers or provide those services covered through other kinds of mechanisms. And unfortunately, one of the consequences of that is that it has driven up the cost of care to all others. So private businesses are paying higher premiums because they're absorbing the cost of that population that's not covered. Private individuals who may be paying their bills, and in Iowa, quite frankly, this is an extraordinary state. Individuals actually pay their bills. And that being the case, they absorb the extra cost because all of those services have to be supported. So I think that the real question is, how do we bring these individuals who today aren't being covered into a system? How do we provide them a mechanism where they can have access to affordable primary care, where they can be cared for more effectively, more appropriately, where perhaps through that mechanism they can receive services that will avoid some of the most expensive services that they're now accessing today. And expanding the Medicaid program in Iowa is a mechanism to do that. I think one of the things we also have to keep in mind is, while today the position is that we shouldn't participate in that, I suspect that Illinois will. I suspect that Missouri will. I suspect those surrounding states will get involved. And so Iowa will be left in the middle. And this is a potential $165 million impact to the economy of Iowa. And that's serving health care, that's serving individuals who want to receive care through health care, but it's also jobs. There's 70,000 jobs that are in the state of Iowa related to health care. So there are very, very practical reasons for why this is important. But also, we feel very, very strongly that there's an ethical underpinning to this decision, and that it is the right and correct thing to begin ensuring that individuals are afforded some ability to have equal access to the full continuum of service and care.
What do you think about that, Gary?
That's an interesting, obviously, topic to talk about, because you're talking about expensive healthcare being emergency room. That's obviously one of the reasons why hospitals really like the expansion of Medicaid, because, like you said, all those costs are borne by us, the consumers of those goods anyway. The businesses don't absorb the cost because they don't cut their profit. We take that in the form of higher cost. So obviously the hospitals would like to receive that Medicaid payment and receive that money. So I have no problem with people trying to protect their costs and make sure that their business is solvent, because if Mercy goes under, we have less hospitals and less access to health care. So I certainly don't want hospitals not to be able to continue operating. That's not at all what my position is on that. But what I have a problem with is, as you said, we have a system right now via insurance and via just going into the emergency room that raises our costs. So when you look at the last 20 years of costs, healthcare has gone up by 750% of inflation. Whereas you look at medical procedures that are not covered either by insurance or by any government program, let's say LASIK, and those costs have gone down while quality has gone up. So why is it that LASIK goes down, but every other medical procedure goes up? And I think the biggest reason for that is you've got those twofold of government and insurance that really takes the incentives out of people for saving and doing the best options for their health care, not just the most expensive ones. I mean, if you think about it in terms of, I go to a grocery store and I buy grocery insurance, and I pay a $20 copay and I get whatever I want. Are you telling me that most people wouldn't grab more steak and more candy and more pop? They're going to go and spend as much as possible on those services because they're only paying a fraction of those costs. But that's the insurance system that we have today, and that's what we're dumping essentially more people into as well, by saying we're going to have private insurance and we're going to have Medicaid that covers everything. So I don't necessarily think that's the right way to go to make sure everybody gets covered. But as far as the ethical perspective, the question I have here is, as I'm a Lutheran, you're Catholic, one of the things that we talk about is Christian charity. Now, it's not really charitable when the government forces it from your hand and gives it to someone else. In any other circumstance, that would be called theft. But we're saying that government taking it from us in the form of taxes and giving it to someone else is charity. I don't feel very charitable on April 15th.
Well, there's also the issue. You bring up an interesting point, and perhaps, Peter, you could respond to this a little bit. Emergency rooms don't have the right to refuse treatment, and that's a government act that's been passed. Is that policy that we want?
Well, that's a little outside of what I would be comfortable responding to directly, but in terms of a couple of things that you were referring to, if the place would be, well, let's get rid of insurance and do something else, I mean, that would be one thing. But I think where we're really at is we've got options on what we want to do to cover the uninsured at this point. We decided in 1965 that there were serious gaps in coverage in the way that we have chosen to do it in this country, right or wrong. Mm-hmm. So we picked up a good big group of the highest cost, highest risk people and put them into government programs in terms of Medicare and Medicaid. We picked up another group in 1997 in the Children's Health Insurance Program. And so this is sort of that next attempt to pick up what's left through the exchanges and through the Medicaid expansion. And in Iowa, there's about 350,000 people who are without health insurance. 80% of those people are working people and their families. So it's not that these are people who aren't contributing to the system. These are people that happen to be working basically at the wrong place. That you can be doing the exact same job, working side by side. One person is going to get health insurance and the other one isn't. And most of those people are not going to be able to afford, because they're about 2/3 of them are making $50,000 or less. Right now, an average family policy is about $15,000. It's actually $15,700 per year for family insurance coverage. And so there's no way that that person can then go out and purchase it, and then it drives behavior in terms of how they seek care in ways that we really don't want. And so that's what we're really trying to address, and most of the cost issues are really cost shifting rather than new cost to the system. So hospitals actually in this whole thing are going to get paid less through Medicare, because the government is subsidizing over on this other side Medicaid, so that some of the uncompensated care costs and the things they used to have to pick up, they're sort of believing, well, we're going to pay you less over here and pay you more by giving these people insurance, and then everyone should be in a better place. On top of that, what Medicaid is trying to do is provide better quality of care right now through a program called Medicaid Health Home Expansion. And so they're trying to take all of the highest cost, highest risk people with chronic illnesses and put them into a better situation to manage those costs, prevent rehospitalizations, prevent going to the emergency room through healthcare navigators and people who are a little less expensive within the healthcare system, to make the whole thing more efficient and more effective, and actually something that would improve the quality for all of us.
And cost?
Well, the cost, again, it's
Well, cost, the
well, I mean, the
hospitals
whole
get-
cost of the Affordable Care Act is estimated to be about $970
Well, I
billion.
guess I'm thinking more personal cost. You know, if we're paying extra money to, you know, to the hospitals
Right.
to afford, you know, care because we're having to pay for all these people who are indigent and don't have
Right.
coverage, is that going to reduce our costs?
Well, the way it's been estimated, and there was actually a very good report that came out last week from the University of Nebraska's College of Public Health on the cost of the Medicaid expansion in Nebraska. And it's going to cost the state there about $150 million, but they're going to get, between now and 2020, but they're going to get in return $3 billion in terms of money that's going to be brought into the state because of that 100%, the 95 and 90% match that you were talking about. On top of that, the economic engine that will be created, they're talking about creating about 10,000 jobs and about $700 million because of the turnovers of those dollars when you come in. And if you don't do that, the cost is going to be about $750 million in uncompensated care to providers and the rest of us, because they say about $1,000 of each of our health insurance policy goes for the cost of the people who don't have insurance. So, you know, yes, there is a cost. Does anyone truly believe we know what those costs are going to be long term? And no, I mean, I'm not going to stand behind that $970 billion price tag or what the impact on the deficit, which actually the long-term impact by most projections is it's going to drive this deficit down, because so much of the cost of Medicare and Medicaid and the effect on the deficit without this. And it's also going to strengthen the Medicare trust fund up through 2024 instead of 2016. And so there's also a lot of actual positive things. But do we know all the financial implications? Probably not. I wouldn't want to stand here and say we do. Is this the right way to do it? You know, again, that's for different people to judge if this insurance system that we have is better than what we had pre-1964, let's say, when we had a lot of people. I mean, we put these things in place for a reason, but...
Yeah, so to underscore a couple of points that have already been made, in the state of Iowa, hospitals actually contribute roughly $900 million in charitable care, as well as what they have to write off to bad debt. Those are bills that aren't paid. The hospital industry nationally, in advance of the passage of the Accountable Care Act, agreed to roughly $155 billion in reductions in our Medicare compensation over the next 10 years. And that was with a understanding that there would be a commitment to on the part of the states in which we exist to expand access to all of those who, quite frankly, contribute to that $900 million that I referred to. So the decision on the part of Iowa to not go forward with the expansion essentially uncouples those. And quite frankly, again, we have to, I think it may be important to consider the fact that we may be one of the few states, and there are only a few states that have taken an adamant position to not move forward with this. Other states will. So those resources are going to migrate to those states that will. And the question is it really good public policy on the part of Iowa to forego this opportunity where essentially initially there's 100% compensation, as was pointed out, and that is reduced over time to that 90% threshold. There are many states in the country, particularly the Gulf states, that are going to see a dramatic change both in eligibility and compensation, because they've set their income levels for eligibility so low that this 133% of poverty is remarkable. For example, the state of Florida will have 10 times the number of eligible individuals for this program than the state of Iowa. We're estimating Iowa will be somewhere around 150,000. The other thing we have to understand is there's a category of individuals within Iowa that currently fall within what's called Iowa Cares. And that's roughly 70,000 individuals. And at this point in time, Iowa Cares is targeted to go away as of December 31st, 2013. And while there's some discussions about perhaps extending that, the reality is we've got to provide services for those individuals. In the city of Cedar Rapids, there are 8,000 individuals that we believe reside here. These are individuals that go to the community health free clinic, and thank goodness we have that. They're individuals that go to our emergency rooms, and now they actually need to go to the university for the more acute services that they provide, because that's where their services are reimbursed for. So that population needs to be addressed. And then there's an additional population that's affected by this, and these are individuals that actually have dual insurance. They have Medicaid and Medicare. And often these are individuals who literally are living on the bubble socially, but have very complex medical conditions. And these are individuals in our nursing homes. They tend to be very, very brittle individuals, and they're very expensive, and they're contributing significantly to the cost of these various programs. This is the consideration that's at hand with respect to expanding access to Medicaid affects a number of people in a very important way.
Right. And those dual eligibles are the ones that Medicaid health home program that I mentioned is targeted for, not strictly, but those are really the high cost, high risk people, you know, the fragile diabetic, et cetera, that's bouncing in and out of the hospital and just really using a lot of resources that if we can manage those situations better, especially with lower cost types of providers, we'll be able to save a lot of money and improve the quality of care at the same time. I did want to just mention one other irony about this whole thing that we're talking about, that if the Medicaid, if the ACA, let's just say, goes through, and Iowa were to turn down the Medicaid expansion, the only people that would not be eligible for a subsidy or assistance would be the people under 100% of poverty. Because the way the law is written, the only people that are eligible to getting subsidized care through the exchange to buy private insurance are those from 100% to 400% of poverty. And so the only way that the highest risk people, if you will, in terms of poverty level, those under 100% of poverty, can get coverage would be through the Medicaid expansion. So you could end up with this really bizarre irony that someone at 300% or 350% of poverty is getting a subsidy, and someone at 80% of poverty barely getting by but trying to get a job will get nothing.
Okay, I'm going to shift us just a little bit, because as we've been talking about this, I've wondered, are we as a people, as a United States, are we responsible to provide health care for everyone? I mean, that's the direction we're heading. And it, you know, as you said, we cover more and more populations. Every couple of decades, we try to bring in more people in. Certainly, it's going to provide jobs.
I think that question points directly at what your view is of the world, so to speak. I think that there are those who really believe that it is an injustice that a government can impose upon an individual, a physician, for example, the obligation to provide a good or service. If you believe that healthcare is simply a good or service that is available for individuals to purchase if they choose or they can afford. But there's another view, which is the view that we as a society have a responsibility to help to form individuals and to support the quality and dignity of their life. And if you subscribe to that, then I think it's very, very difficult to not take a position that we have an obligation to look for ways in which we can ensure that they have access to health care, because good health is fundamental to being a contributive citizen, a contributing member of society.
Gary, I'd like your input a little bit on this before we...
Well, I guess the question I have there is, I understand the two frames of reference here, but eventually something has to be paid for. Their cost has to be borne by someone. Mm-hmm. Is it honestly fair, if you want to talk about being, fair, dignity, so on and so forth, that you take from me to give to someone else, or vice versa, that someone has to pay for me because I choose not to do something? Mm-hmm. Is that honestly, ethical? Is that fair? Is that right? I understand the concept of, like we talked about earlier, the Christian charity, mm-hmm. but that means that I do it personally. I give to someone else, not that someone takes it from me to give to someone else.
It comes from inside you, from your beliefs and your understanding of the world, that comes from you without any obligation. Right, somebody is not forcing you to do it.
And I believe, as you said earlier, is that we should be helping people, but I believe that we should be doing that personally, not at a governmental level. When you look at the standpoint of things like private charities give out way more money and do better at distributing those things than government does, isn't that more ethical to let some place like the Red Cross do those things than for government to take it and use it for political purposes and re-election and demagoguery and all the stuff that we get during these election cycles? Isn't that better to have them do it than to give it to government? And that's really, the fundamental difference, I think, between the two views is who is responsible for doing that social activity.
And I think in the case of health insurance, that's very difficult for an individual to be able to do that, and especially with the way healthcare costs these days. We've got, in addition to the 50 million people that are uninsured, we've got at least another 25 million that are underinsured. And so in the event, and businesses, because the costs to them are going up so high, and they're pushing the costs, either reducing coverage or pushing the costs onto their employees more and more. But we're also subsidizing the businesses, because the businesses get to write off the cost of their health insurance to the tune of about $350 billion. So it isn't also, I'm doing mine, and that, we're all being helped. And we're all paying a payroll tax for Medicare that's going to help support us. And so I do think it's much more, we're already in it together than it's a little hard to say that with insurance, I think, at this point. But from just an ethical perspective, from myself as a professor in the College of Dentistry, in my role in teaching dental students, one of the things that we do emphasize is professionalism and ethics, and the responsibility that comes with being called a doctor. You aren't just opening up a plumbing shop, nothing against plumbers, but you do have a responsibility to look out for the good of your patients beyond what they are capable, and the good of the community beyond yourself. And that comes with, I think, that title, as well as going to a state-run institution where we're all being assisted in our education as well.
It is very difficult. I mean, certainly I understand. Any medical professionals, are you doing this out of the goodness of your heart, or are you doing it for compensation? There's a lot of gray areas in there. Well, this is very interesting, and we could actually continue talking about this for some time, but unfortunately, we run out of time today. Well, thank you very much for this discussion. I didn't have to ask many questions at all. It's great. And I want to thank all of you for joining us today on Ethical Perspectives in the News. Take care, everyone.